Welcome back, everybody. Sorry it's been a while between videos. There just really wasn't a lot going on. It was a lot of just waiting around. I've had all of my appointments. Everything has been processed and testing is done, and I've been cleared for surgery. My surgery date is June 19th. So today I believe is May 29th. So I'm at I think exactly the 3-week mark. Excuse me. So between now and then, I have one more appointment with my nutritionist and one more appointment with my surgeon. Both of those appointments will be a week before I have surgery. I've done all of my pre-admission testing already, and then I do have to have one more clearance appointment with my primary doctor, which I have scheduled in a couple of days. And they will send a letter just stating that I'm clear to have surgery through them, that they still support the surgery and all of that stuff. And then it'll just be kind of a waiting game. I don't have the 2-week liquid diet that a lot of people have. My surgeon does. Excuse me. It is 2 weeks, but it's kind of like a partial liquid, partial food. You do 2 meals that are like protein shakes or smoothies, and then you have 1 meal that is a lean protein and potentially some vegetables. Again, they want you doing all of your lean protein first, so kind of whatever you eat after that is okay. Completely off, no sugars, no condiments with anything. They don't want you having anything vinegary, nothing super fatty, no mayonnaise, no avocados, no ketchup. And then I also have to cut back or change the type of anti-inflammatory medication I take. I do have bilateral plantar fasciitis, and I work on my feet 12 hours a day. So I normally take Advil at least once a day, almost every day. So that will have to change as well. They just don't want anything that is a blood thinner that may cause you to bleed more. Again, I have to start doing that 2 weeks prior to surgery. 2 weeks prior to surgery. And then other than that, there's not a lot going on for me. It's again just the waiting game at this point in time. Just cutting out caffeine, quitting smoking, which is a big one. Anyone out there that smokes, know that you're gonna have to quit, and hopefully you're gonna want to quit. I know this is also a good motivator for me because I don't want to be smoking anymore, and this is just one of those added bonuses of just another reason why you need to quit, and you have to quit. So that is a process that has been hard and difficult, but is happening. I have not quit 100% yet, but it is very shortly on the horizon. Everyone talks about cutting down or going to patches or chewing gum, vaping, and I've kind of done the vaping thing to help cut down a lot. I've cut down a lot when it comes to how much I smoke at work, at home, in my car, whatever. And it's just kind of the point now where it just has to be cold turkey, because at some point in time you just have to stop. So that actually is hopefully tomorrow for me, is just the no more and just suck it up. Figure give my body 3 weeks to get everything kind of cleared out. I mean, I know it only takes 3 to 4 days for nicotine to actually leave your system, but the habit and everything like that's going to be pretty hard. But it's just one more thing that needs to be done, and grudgingly but happily to do it, because I don't, I don't want to be smoking anymore. I'm in the medical field. I know it's horrible for me. Everybody on the planet knows it's not good, yet we still do it. It's a coping mechanism. It's a tool that we use, and it's one that I just have to get away from, I guess. And I know it's going to be hard. I don't expect it to be easy. I'm not expecting it to be easy for anybody else out there. I'm not trying to make it sound like it's easy, but it's just one of those things that has to be done at this point in time, and I want to do it. I really do. I will say one of the things I kind of wanted to talk to everybody about, and I find that there's a lot of stigma about this, but when everyone goes in for their psych eval, everyone's like worried about failing and like, oh, what if they make me do therapy, or what if they make me do other things that may delay surgery. And personally, from my opinion, if they're going to make you continue to do more therapy because they don't feel like you're quite ready for surgery yet, that's not something to delay your surgery. Yes, date-wise, that may push things back and you're hoping for it, but mentally being ready for this type of surgery is so important, so very, very important. And if you're not in a mentally healthy place, doesn't matter what surgeries you have or anything like that, you're gonna gain the weight back. It's gonna happen. It may not be 2 years down the road, it may be 3 or 4 years down the road, but you have to deal with what goes on in your head and deal with what goes on in your body. And if you're not willing to deal with what's going on in your head, then personally I feel like surgery is going to end up failing. Or you're going to end up taking surgery to an extreme and end up with an eating disorder and being severely malnourished and then potentially having cardiac issues, because if you're not eating and your body is depleted all of your muscle, your heart is a muscle. It will attack your heart next to fuel itself. So you don't want to go swing to the other side and end up with an eating disorder and causing even more health issues than potentially if you had just stayed overweight. So please, please, please get your mental health in order. I will probably talk about mental health a lot in future videos. It's something that I'm very passionate about. It's something that I want to potentially end up making part of my career. And it's just so important. And it's not something that we as Americans really talk about very often or focus on very often. We're just like grind, gotta go. And we don't think about taking care of our mental self as much as we take care of our physical self. And you can't really have one without the other. You can be as healthy as you can be physically. If you're not healthy mentally, you're just fighting yourself, and there's no reason for it. When you'll invest in getting your nails done or your hair done or getting waxing done or going out shopping and spending a lot of money on clothing or going out to eat or entertainment with your friends and family, one's like, you can invest in therapy as well, and is 100% an investment in yourself that doesn't only help benefit you, but it benefits everybody around you, because you become a better, healthier, more well-rounded individual for yourself, and your friendships will be better, your relationships will be better, you'll be a better parent, you'll be a better sibling, because you've taken that time to invest in yourself. And I think it's well worth it to make that investment versus going out and getting your nails done or getting your hair done. Like, skip that a month and go to therapy instead. Because no matter how pretty you try to make yourself, if you're not happy on the inside, it's just a painting on the outside. And get yourself to a place where you're happy on the inside, and that all of those other things that you do are just added bonuses that make you feel good or are part of your self-care routines. And it's no big deal. Like, I'm not saying don't do it, but don't do that instead of getting yourself mentally healthy. Do that stuff as a part of getting yourself mentally healthy. This is a huge journey everyone's taking. It's surgery. You're changing your body. You need to change your mind too, because we all didn't get big just because of our bodies. There's been sometimes illnesses or injuries that have happened, but normally if you have an injury or an illness that has caused you to gain a substantial amount of weight that you're now looking at having surgery to fix, there's probably some type of trauma or depression or negative self-talk that goes along with that. And why not fix that too? Yes, it's costly. A lot of insurances don't really do a good job at helping cover the cost. But you can go online, you can search for therapists that work on a sliding scale. Now they have betterhealth.com that does over your phone, like you can do text message or video chats with therapists that I think they're like $35 a week maybe. There's definitely avenues you can take to have it be a lot more cost effective, but just go out there and do it and get yourself in the best place humanly possible so that when you have surgery you can be as successful as possible, because this isn't something that anybody wants to do more than once. It isn't something anybody should have to do more than once. And if you're looking at potentially having to do this again a second or a third time, I please beg of you to see a therapist and get at least 6 months of therapy under your belt before you do surgery again, before you even contemplate doing surgery again, because obviously there's a lot more going on mentally than physically. And until you take care of that mental stuff, you're never going to get your body looking the way that you want it to look. And if you're having a hard time after surgery with the way that your body looks and still having a lot of the negative self-talk and the negative thoughts that you had about yourself, and you like can't see the changes that have happened, again, that probably is a good indication that you need a little bit of therapy and someone to talk to and someone to work some of those issues out, because you've had things ingrained in your brains so effectively over time that you just can't not see it anymore. And therapy will never hurt. I mean, it will hurt. It's hard. It's hard work. There's probably going to be a lot of crying and a lot of tears and anger and frustration and a whole gamut of emotions, but it will always benefit you. As long as you find a good therapist and someone that you click with. Always remember, you're hiring the therapist. It means you can fire the therapist. If you don't like them or you don't feel like you guys connect, find a different therapist. Not even necessarily a better therapist, but find someone that's better for you. Because that's the whole point of this, is finding someone that you connect with, that you can talk to, that's going to be supportive and push you outside of your comfort zone to make you a better, well-rounded person. I don't know if anybody has any questions about anything. If anything that I'm doing, I am personally going to therapy. I've been in therapy for 3 years. I actually have an appointment later on today. And a lot of what we're discussing is right now all weight loss stuff and stuff kind of in relationship to surgery. It's not fun, but I know all the hard work I've done in the past that wasn't fun has all worked out to be very beneficial to me in the long run. So, kind of an open book. Ask questions. I'll help as best as I can, or I'll help direct you to where you potentially need to be directed to get help. If you have any questions about the surgery itself, or what my pre-op diet looks like, or what pre-admission testing looks like, shoot me questions. I work in the medical field, so sometimes I forget that some people don't know what like the details of all of that are. And again, I don't come in with any comorbidities, so my pre-admission testing was blood work and I think a urine sample. That was it. They took my old EKG from when I did my first EKG, because I don't have any cardiac issues, I don't have any diabetes, no hypertension, I don't have sleep apnea, I don't have a hernia, I don't have any other issues. So outside of the fact that I'm morbidly obese, I'm fairly healthy. So the things that I've had to go through are fairly minimal compared to some people who have other comorbidities. But I think I may know enough to be able to at least be somewhat helpful. And if I can't, I'll try to find the answers for you. I hope everyone's having a wonderful day, and I'll hopefully catch you next week or so with another video. Bye!